Hi, I'm Dr. David Danielson. I'm Vice President of Veterinary Technologies here at SynDaver, and I want to introduce you to Claudia, which is our surgical canine simulator. She basically can do pretty much anything you need for surgical training, and I wanted to show you step by step the procedures that you can do with her. The beauty of this simulator is that it has the ability to bleed. It is vascular, and I want to demonstrate that by turning on its pump. So as you can hear, blood now is flowing through the body. You can see here the pulse. So we have an intake, the aortic, and then venous return. And then in this regard, it'll start going through the dog, into the heart, and into the vasculature. Going from basically the nose to the tail, I want to go through each procedure, initially going through the technical things that this can do. And I also want to demonstrate how this vascular capability is unique and really is helpful in the simulation. First off, the dog is able to be intubated, where you can actually hook it up to a respirator. It has absolutely realistic anatomy within. It has the glottis, it has the tracheal rings, and its intubation is actually as it would be if you were intubating a real dog. This child's already intubated. It does have the capability, as I said, to breathe via respirator, and here I have an ambu bag, which if you look, you can actually see some of the movement from that. Following the line, you can actually see these vascular pads, which allow blood to be drawn from the cephalic. It also allows catheterization too. You can run fluid into this dog as you would with a patient, and you have the capability of drawing or putting in both the forearms on the cephalic. You have your jugulars, and you can actually see the pulsing here, where they can draw blood. We do have the capability of placing a central line as well. This is a modification to the canine, which we do have. And then going further back, because monitoring your patient in anesthesia is so important, we have the capability of detecting and feeling the femoral pulse. This pulse on the caudal aspect of the model does allow the student to kind of check to make sure that things are pulsing properly. As you would for your real patient, you'd want to determine that everything's appropriate during the surgery.